is Georgina Chavez, and I'm a World Health Organization doctor. And I'm here to inform you about Ebola, an infectious flu-like virus that's going around. Ebola is a hemorrhagic disease caused by incontrollable bleeding inside and out of the body, which spreads through the body and damages the immune system and organ. It could be confused with common colds, influenza, or measles. Researchers believe that disease is zoonotic, meaning it was animal-borne. Only if you are surrounded with contaminated areas, not from breathing the same air, water, or food. How to prevent it? Avoid any contact with contaminated areas or infected surfaces like infected blood, needles, secretion, body fluids, or any things that the disease may have been or surrounded with, if that makes sense. Also, beware of people or animals that may appear with symptoms of Ebola. The signs and symptoms of Ebola are fever, vomiting, diarrhea, headaches, joint muscle pain or aches, weakness, or rashes. Be safe, because even though you think you have Ebola, you may have Ebola. Now, how did we get Ebola? Now we start with Praline.
How many of you guys have me figured where has Ebola came from? I wonder why. Well, in 1976, Ebola actually came from Sudan, which infected over 284 people. The mortality rate of it was 53%. Later on, it spread to Zaire. In Zaire, the mortality rate increased up to 88%, and it affected 318 people. This virus became known as Ebola due to the Ebola River Valley, which was right next to, Sudan. The third strain of Ebola was identified in 1989. When infected monkeys were imported into Western Virginia from Mindanao in the Philippines, as Stanford researchers have stated. Nearly 90% of infectious victims of Ebola have not survived. In fact, they died. It has been said that bats are the natural hosts of Ebola, which later on spread to rats, monkeys, and insects in 1994 and now to humans today. Although there has not been any proof of this statement. But be safe. Good luck to you guys. See you soon.
Elizabeth, the fever is a calcified virus belonging to the family called filovirus. People who have been exposed to Ebola should not travel a commercial airplane. Some details about Ebola is to keep safe the person safe from separate from others as much as possible. I will let all airport personnel know about what is going on with Ebola.
In addition to what Elizabeth said, airline crews have been trained to spot the symptoms of Ebola in passengers flying from places where the virus has been found, such as Africa and Sudan. They're told to quarantine the people who look infected. And here I have a chart over the course of people, how many cases there have been, and the people that have died. As you can see, more people have been caught with Ebola, more cases, but less people have died. As you can see, in 1976, when the virus was found, nearly almost everyone with Ebola has died. And currently in 2014, there has been 1,134 cases, but only a little less than half have died. Ebola typically kills about 90% of those infected, as you can see in the beginning. But now the death rates have dropped roughly around 60% thanks to early treatment, as you see in 2014. Once the virus takes hold, many die within the average of 10 days from severe bleeding. The risk factors of Ebola may include traveling to Africa, the visitors in Visitors that work in the area where Ebola are most likely to get Ebola. People who conduct animal research, such as monkeys imported from Africa or Philippines, may get it because that is where they originally came from. People who provide medical or personal care, such as people who care for sick relatives, may get Ebola or don't use protective gear such as masks or gloves and don't wash their hands before and after. People who prepare for burial may be at risk of Ebola because people who die from Ebola are still contagious and people can still get it. In the top news, we have recently found 2 survivors in Atlanta, 59-year-old Nancy Ritbol and 30-year-old Dr. Ken Brantley were given a new drug named ZMatt and walked out of the hospital Ebola-free. But even though they are Ebola-free, later on it can mean that they can still get it because they have once got it before. So there is still hope to stop and put an end to this horrendous epidemic. And be safe, everyone, and I'll see you guys next time.
I need assistance.
I am a nurse. I can help you.